My name is Bob Kale. I was diagnosed with stage 4 colon cancer.
The doctor set us down in this little small quiet room and told us he had 2 brain tumors. It was like unreal.
And boom.
I could not even speak.
It takes a minute to move after you get the diagnosis. I mean, you physically move because you have to, have to go home, but just trying to appreciate the word.
The initial surgery removed part of my larynx, the base of my tongue.
I had to have chemotherapy and radiation.
I had 1 treatment last week, and treatment will be every other week, as long as I can handle it.
Surgery, chemo, radiation, I've been on treatment nonstop for the last 10.5 years.
It totally takes over your life. It changes who you are, changes how you look at things. You're no longer the same person. It's pre-disease, post-disease, 2 different people.
I lost the way that I function in life. Everything that I knew pretty much was changed.
We do have a lot of struggles. We do understand a lot. It's not as easy for us anymore.
The transformation of all of this is really overwhelming. I mean, it's not easy at all. It's a life-changing thing.
To your regular family's life?
Basically, her getting chemo and incisions.
Does it make you feel sad sometimes?
Sometimes. If it's like growing really bad, it makes me pretty sad.
Does it make you feel scared?
Very much.
I'm not even sure if I'm going to be able to work. They said there's a possibility that I won't be able to see.
Cancer makes you look at life differently because you don't know what tomorrow holds. You don't know, and especially after each chemo, if it stops working, that's when the scare comes in.
These other things, other physical things that you have to deal with, to throw in something like navigating a health system is almost monumental. You can't even think about how to even approach it.
We'd like to think we're taking good care of people with cancer because we think we have the best medical care. And I do have access to good doctors, but there's a price for that. You're fighting to get into the trials. You're fighting to find the research, get your insurance to approve it. And there's a lot of gaps. There's gaps for young people, for older people.
You can't get anybody to help you do insurance forms. It's a nightmare, and having to be on the phone and waiting on the phone because you get put on hold and you wait and you wait and you get moved to somebody else on the phone and then somebody else, and then the insurance company denies the coverage, and and then you have to appeal, and it's just around, and there's nowhere to get help for that.
I was just hospitalized. My medicine costs about $100 a month. I look at our bills and I don't know how we do it. But if I have to cut back on food, if we have to cut back on other things, we will, just so that I can have my medicine and things.
It's insurmountable, the amount of bills you get from a doctor's visit, like a neurologist, which was so necessary because I had brain surgery. So I had to see him. The whole process just, exacerbated my depression. So I had to see my therapist. So for like 2 months, those were the only 2 I was able to see. Those were the only 2 I was able to afford.
I lost my life. The life that I had, I did not have my finances. I'm not used to having to go to anybody, have to depend. Oh, that was awful. Just horrible. Not being able to fend for myself entirely.
Several weeks ago, we saw the bankruptcy attorney and initiated a bankruptcy proceeding.
The problem was when I applied for Social Security disability, even when you're eventually approved, there's a 2-year waiting period for Medicare. Now I'm only given 2 years to live, so I'm probably going to be dead before I ever even qualify.
I mean, when you have cancer, you're scared, you're worried as it is. Once you start getting into the treatments, you realize how much it's costing you. It makes you, it scares you. It's very scary. It's very stressful. It's all you think about. And then you think about what you're doing to your family. They might be better off without you because they can survive without you, without the burden.
It was more stress to try to coordinate the care, and it was more stress to try to deal with the problems associated with the insurances and so forth, which is an ongoing thing, than it was actually having the disease.
It was really, really depressing, and I had to fight hard not to let that depression settle in and stay.
If you're down, you're never going to feel any better. It's just, you're just going to keep going in that hole and keep dropping, falling down.
One of the major problems of dealing with a disease like this is being alone, a feeling of being alone. And most people don't understand what a cancer or a disease victim means by that.
What I went through at home was the depression, the anxiety, and just not knowing what to do about those things.
You don't know what you need until somebody asks you, do you need it?
The more we can understand about the social emotional needs of cancer patients and what we can do to help them, the better we'll be able to improve not only their quality of life, but also the health outcomes.
How do you piece together kind of more of a holistic approach to dealing with a cancer patient and saying the only problem with that patient is not just dealing with that cancer tumor, but then after we piece that person back together again physically, how do we help them reintegrate themselves back emotionally and socially back into life?
It becomes really clear to me that we must get involved in policy development. There are too many people that are affected by cancer. There are too many issues that through the development of a policy institute could be moved ahead in a positive way. It's such a huge part of so many people's lives. It has to happen.
So it's important that we at the cancer support community ensure that all people impacted by cancer, particularly the most needy among us, have access to care, have access to support, have access to distress screening.
I think if I get it right, the motto for the center, so that no one has to face cancer alone, says it all.